I welcome you to the first lesson of this video course on this book, Positive Health, Health Beyond Pills. This is a book that talks about how to think holistic health, how to pursue holistic health, and how to live holistic health. This first lesson is to attempt to define well-being, to help describe well-being, to help explain well-being. And the main reason for this lesson is because there are people who define health only in terms of the absence of physical disease or the presence of physical health only. So they are likely to miss out on definition of health in terms of quality of life and not pursue that quality of life that they can achieve as far as healthcare is concerned. So this lesson number one, is to try and define well-being to mean something more than the presence of physical health or the absence of physical disease only, to suggest that well-being focuses on the entire person, the quality of life of the entire person. And so that should be the focus of your healthcare, which is to achieve quality life that involves every area of your life. Now, before I talk about what well-being is, I need to talk about what well-being is not. So number one, we know that well-being is not the absence of physical disease or the presence of physical health only. We also know that well-being means much more than taking medications or going through surgical procedures. We know that attaining well-being means much more than illness care. That means that getting sick and then we taking you out of that sickness. Or when you feel ill, you have some symptoms, and those symptoms are eliminated. That discomfort is taken away. That pain is taken away. It does not mean that you have achieved well-being. Okay, well-being means much more than your symptoms being eliminated, and then you feel comfortable. So, what is well-being? There are several words that are being used to describe well-being. Words such as a good life, quality life satisfaction, fulfillment, peace of mind, happiness, feeling good within, feeling good about yourself. Words such as functioning well. And then we like to combine the words like mental health, emotional health, social health, physical health together and call it holistic health or well-being. So you can tell from the descriptions that I've given about well-being that it means much more than the absence of physical disease or the presence of physical health only. It also means much more than taking medications or going through surgical procedures. It means much more than elimination of symptoms or some pain or discomfort. Again, judging from the definitions of well-being and the words that are being used to describe well-being, it appears that well-being is the greatest human need, and well-being speaks a universal human language. It also appears that well-being is the greatest human pursuit, or should be the greatest human pursuit. And that is why this course is devoted to understanding the concept of well-being and pursuing well-being. So we're going to go to the second lesson. In the second lesson, from the second lesson, we are going to discuss some concepts that can help us appreciate the subject of well-being better.